This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Thrioshot DS Kit is an effective combination therapy aimed at managing infertility in women, particularly those facing challenges related to ovulatory dysfunction and polycystic ovary syndrome. The formulation combines Clomiphene, Acetylcysteine, and astaxanthin to address various underlying issues affecting fertility, making it a crucial option for women attempting to conceive. Indications and uses. This medication is indicated for the management of infertility resulting from various conditions such as ovulatory dysfunction, polycystic ovary syndrome, PCOS, amenorrhea-galactorrhea syndrome, and psychogenic amenorrhea. By targeting these specific reproductive issues, it assists in improving the chances of conception in affected women. How it works. The medication works through a synergistic effect of its components. Clomiphene stimulates the ovaries to promote the production and maturation of healthy eggs, enhancing fertility. Astaxanthin serves as a potent antioxidant that protects egg cells from oxidative damage, thereby improving their quality. Acetylcysteine contributes by enhancing endometrial thickness, which is essential for successful implantation and pregnancy. Directions for use. Thrioshot DS Kit should be taken strictly as directed by a healthcare provider. It is advisable to swallow the capsules with water without crushing or chewing them. Dosage and duration of treatment will depend on individual factors such as age, body weight, and specific health conditions, hence it is crucial to follow the physician's guidance. Possible side effects. Possible side effects may include allergic reactions, ovarian overstimulation, blurred vision, and liver problems. In case of severe reactions or symptoms, it is imperative to consult a healthcare professional immediately. Precautions and warnings. This medication is contraindicated in pregnant women, breastfeeding mothers, and individuals with a history of liver disease or bronchial asthma. Prior to starting treatment, it is essential to disclose any pre-existing conditions or allergies to the healthcare provider to mitigate risks. FAQs. 1. How does Thrioshot DS Kit help manage polycystic ovary syndrome? It maintains hormonal balance and improves pregnancy rates in women with ovulation issues. 2. Can I stop taking Thrioshot DS Kit suddenly? It is vital to continue until advised otherwise by your doctor to avoid treatment failure. 3. Is Thrioshot DS Kit safe for pregnant women? No, it is not recommended for use in pregnant women. 4. What should I do if I forget a dose? Consult your doctor for guidance, but do not double the dose. 5. Can Thrioshot DS Kit lead to multiple pregnancies? Yes, it increases the chance of multiple pregnancies. Thank you for watching. If you have any questions or suggestions regarding this topic, feel free to leave a comment below. Your feedback is valuable to us.